All right, so welcome to the OCTC Veterinary Technology Teaching Hospital. We have a unique hospital at our disposal here at the college to teach veterinary technician students the real-world clinical skills they need to go out and practice. Starting with the reception lobby area that any pet owner would start with in bringing their animals to the veterinary hospital. Our students learn to run the entire paperless system for the hospital, for the client record, the medical record. And then once those patients are checked in, then we bring them to the examination room, which right now students are using for a learning activity for anesthesia, drugs, and medications that we use. Mrs. Groves, one of our LVT faculty, are working with second-year students on their anesthesia knowledge. This also reinforces what they learn in pharmacology, which they have this semester as well. So this is a therapeutics class, a clinical procedures class, students that will be graduating, and a year from now will be working in clinical practice. Moving into the clinical care area, Mrs. Groves is rotating students in from exercises in their techs into the surgery and dental areas. Today her focus is the anesthesia skills and knowledge needed to work in clinical practice. So we're going to wander around and look at some of those areas they're working in and ask and interact with some of them. But we also in this hospital have a lot of unique features. This room is a dual purpose room. We use it for anatomy labs as well. We use it for all of our clinical procedure skills training. So this entire hospital is itself a laboratory for skills instruction, testing, and reinforcement. So if we go towards the surgical suite, we'll pass through the room where we sterilize instruments we call the autoclave room. You'll see a lot of activity going on. You'll see a lot of the instruments laid out and labeled. Our students this semester have had to learn hundreds of different instruments, their names, their uses, how to properly clean them, organize them, put them in packs, and sterilize them, getting them ready for surgery. Once those packs are sterile, they're kept here on this rack until we use them. And next semester, their last semester before they graduate, students will actually be performing with me live animal procedures. But the most important part of any procedure is the anesthesia. So today, they're learning their anesthesia skills. So we're going to be quiet as we pass through surgery and watch Mrs. Groves teach a little bit, and then I'll take you to another area where we'll interact with some students.
Okay, sounds good.
So this is our new capnography machine here. We have this, and if you have capnography, what is it measuring? What's capnography going to measure? It's going to measure the CO2 or the carbon dioxide. Now this is a side stream capnography unit. And if you think about this, we have our breathing circuit here that our patient's attached to. And at the end of our breathing circuit, we have our patient end, where our patient's endotracheal tube will be attached. And our side stream capnographer has an end that twists on. It's pretty similar to an IV tubing line. And if you notice, it has these ends have a cap here. These come right off. And if you notice, they are, it has an edge there where something can be secured on there. And that is where our side stream capnographer attaches. So as that patient expires, it's collecting that sample through this line, and it connects to our capnographer machine. So if you see, this is key fitted specifically for this item. And then this is plugged into our machine where it can give us not only a numerical value of our CO2 levels, but it also has a waveform. And in the handout that you all have now, there is examples of your normal EtCO2 waveforms and then abnormal. Your normal ranges for your capnography that we're going to be monitoring, you want your patient to be between 35 and 45 on our machines here when you're monitoring your anesthetized patient. So, now that we have this, I want you to properly hook this up to our machine. Again, this needs to be done before the monitor's ever turned on. So they're not only color-coded, but they're key-fitted. They're also labeled on the monitor. So if Addie, you will plug in this properly first. Now, if y'all want to watch, I do want y'all to see where that properly goes. It's super important know to see that key fitting first. You should not put that in there and twist until it fits in because it can bend the wires that's in that plug there. So make sure you verify how to place it. There's usually an arrow that says on the top of that handle there. Yep, perfect. See here that snap? Now, this is a very expensive part of this monitoring piece of equipment. So important that it has its own home on the back there. So place that in that tray there. We want to be very careful that we are not bending wires. Okay, those wires are very, very
Ms. Groves does an excellent job. She still, in fact, works part-time in a local practice just to keep her practical skills sharp, but she's very good about teaching these clinical skills. We'll go on into the other area where students are working today. And students in this skill section, and you guys give me some feedback, you're being asked to put together the anesthesia machine so that you know every vital part and leak check it. It's very important that an anesthesia machine be functioning properly before we hook it up to a patient. And our technicians can't call on just anybody to do that. They do that themselves. They have to know the machine well enough to take it completely apart, service it, and reassemble it, and then leak check it before they will use it in a surgical procedure. Technicians have a tremendous amount of responsibility in the surgical suite in veterinary practice. So you guys keep doing what you're doing. We don't want to interrupt what you're doing. Do you feel comfortable after this lab that you're getting the hang of what you need to check on these anesthesia machines?
Yeah. Oh yeah.
Okay. One of the common things you'll do in practice is making sure that the rebreathing system is correct. What do you change out on a regular basis?
The carbon monoxide canister.
Right, the soda lime canisters.
Yeah.
They have to be changed out frequently to make sure that patient's rebreathing circuit is functioning as it should be. Okay, and that's the technician's job, to make sure that machine is serviced on a regular basis. Okay. As far as the size of the patient, as Mrs. Grove's gone over the different size patients, what we use for rebreathing and non-rebreathing circuits. Okay, what size would use, what is your cutoff between breathing and non-rebreathing?
7 kilograms.
7 kilograms, which is approximately 15 pounds. Anything less than 15 pounds has a less ability with their lungs to push air, so they have to use a non-rebreathing circuit. Whereas those larger pets, then will use the bigger circuits because their lungs can move. You remember we talked about tidal volumes? Back in physiology a long time ago, this is where you apply a lot of that information. Today in pharmacology, when we talk about respiratory therapeutics, we will tie in a lot of what you're learning this morning in the clinical lab. Okay? Good job. Keep doing what you're doing. Don't let us interrupt you. Okay? You've seen the rest of it. Those are the basic skills this morning they're learning. Anything else you want me to emphasize today? I'd be glad to point out anything you want me to answer for you.
You might want to share a little bit about the selective admissions process and the requirements.
Right. Our program is selective admission because, as you can see in our hospital, and if you went in our classroom, we have a limited number of spots. Our classes are capped at 24 students per class. We are a young, relatively young program, about 8 years old. We've been running around the low 20s. So we're getting a lot more applicants as word gets out that we are a fully accredited, in fact, we're the only fully accredited program in this region of the country, Western Kentucky, Southern Indiana. So to give students the best chance for acceptance into the new fall class, and we only start new classes in the fall, they need to contact us and get their application forms. That is a separate application from application to OCTC. You can apply to OCTC online at no cost, and there's no cost for our application, but it is a separate detailed application, and April the 1st is our deadline for receiving those applications for the new fall class.
Okay, perfect. Are there any prereqs that the students have to have before they can apply?
We have admission requirements instead of prerequisite courses. We
Okay.
need to see that you are a serious student, especially in the areas of math and science. We'll look at high school GPAs. We'll look at GPAs from any previous college coursework. And unless you have an associate or bachelor's degree already, then you must meet the ACT requirement of a minimum of 20 or above on your ACT exam.
Okay.
These are all academic measures to let us know that you're ready for a strenuous curriculum in a healthcare field that is quite broad and very varied. We do not have those prerequisite courses. We have built our 2-year AAS program to where even a high school graduate could complete all the gen ed requirements and their veterinary courses within 2 years.
Perfect. All right. Thank you very much, Dr. Leach. We appreciate your time.
Thank you. We appreciate it.